Thumb collateral ligament reconstruction restores stability after ligament injury. It's often needed following falls, sports trauma, or repetitive strain. The procedure re-establishes strength and alignment for stable thumb motion, enabling pain-free grip, pinch, and precise hand control. The 3x8 mm design ensures precise fixation for small joint anatomy with minimal tissue disruption. Made from biocompatible PEEK, ideal for small finger and delicate joint repairs. Provides immediate and stable interference fixation for ligaments or grafts. Engineered for accurate tensioning and simplified ligament reconstruction. Position the patient supine with the injured arm resting palmar for access. Harvest a 3 mm wide palmaris tendon slip, ensuring a minimum length of 6 cm. Measure the tendon using a graft sizer and trim if diameter exceeds 3 mm. Secure both tendon ends using #20 BioBraid suture with needle. Insert a 1.2 mm guide wire bicortically at proximal phalanx, palmar to the midline, 5 to 10 mm distal to the joint. Insert another 1.2 mm guide wire bicortically at the first metacarpal head, 5 to 10 mm proximal to the joint line. Use a 3 mm cannulated reamer over both guide wires to create bicortical holes. After reaming, remove both the cannulated reamer and guide wires. Introduce the suture shuttler loop through the metacarpal hole using suture shuttler. Retrieve one stitched tendon end along with 1.0 mm suture tape. Secure the tendon and suture tape using a 3x8 mm interference screw. Pass the suture shuttler loop through the proximal phalanx hole. Retrieve the opposite end of the stitched tendon and 1.0 mm suture tape. Maintain the PIP joint at 20 degrees flexion, neutral in the AP plane, without rotation. Fix the tendon in the proximal phalanx hole using a second 3x8 mm interference screw. This completes the augmentation of 1.0 mm suture tape with collateral ligament reconstruction. The thumb is immobilized in a splint or cast for initial healing. Gradual motion begins under guidance to restore flexibility and strength. Avoid forceful grip or pinch until full stability is regained. Regular physiotherapy ensures smooth recovery and functional restoration.